the external as well as the internal features of the spinal cord, right? So what is nervous system? So you have some idea regarding the nervous system. So it is a system. It provides a complex mechanism by which living organisms can react to ever-changing external as well as the internal environment. Okay. And coming to the further subdivisions, so it can be divided into central and the peripheral nervous system. And the central nervous system, it mainly consists of brain and spinal cord. And the peripheral nervous system, it consists of 31 pairs of spinal nerve, 12 pairs of cranial nerve, and it also consists of the autonomic nervous system. As you know, it consists of mainly the sympathetic and the parasympathetic nervous system. Now, coming to central nervous system, it mainly consists of brain and the spinal cord. Okay. Now, this is the brain here, and this is the spinal cord. Now, coming to the different anatomical classification, like how it is further divided into different parts, so that you study the central nervous system into or under different categories. Okay, so first one is the cerebrum. So the cerebrum, in this figure you can see, so this is the cerebral hemisphere. Okay, so the cerebrum, it mainly consists of two cerebral hemispheres. So it consists of the cortex, the white matter, as well as the basal nuclei. So this is the cerebrum. So this is how you study the central nervous system. You study the cerebrum. Then next is the diencephalon. Okay. Now this purple color structure here. So this is the diencephalon, which mainly consists of thalamus, hypothalamus, as well as epithalamus. Okay. So you study central nervous system under following categories. So cerebrum, then the diencephalon, the next is the brainstem. So in this figure, so this green color structure is the brainstem, which consists of the midbrain. So this is the midbrain here. So midbrain, the next is the pons and the medulla. So this is the brainstem. So midbrain, pons and medulla. Then next is the cerebellum. So this is the cerebellum. Okay, also known as small brain. So this is the cerebellum here. So, and this is the spinal cord. So this is how you study under different categories. So cerebrum or the cerebral hemispheres. Then under diencephalon, you study thalamus, hypothalamus, as well as epithalamus. Then under brainstem, you study the midbrain, pons, and medulla. The next is the cerebellum, and then the spinal cord. Now come to the different terminology that you use in central nervous system is slightly different than other organs. See, for superior, you use the terminology rostral. Okay, for superior, you use the terminology rostral, and for inferior, it's caudal, and for posterior, you use the terminology as dorsal, and for anterior, it is ventral. Okay, for superior, rostral, for inferior, caudal, for posterior, dorsal, and for anterior, it's ventral. Okay, so the superior, so this part is rostral, so this part is the caudal. So ventral and the dorsal. So these are the different terminologies you use here. Now the basic organization of gray and white matter. Okay, so the brain as well as the spinal cord, it consists of gray as well as the white matter. Now the organization of gray as well as the white matter, it is different in cerebrum and in the spinal cord. Okay, so in case of cerebral hemisphere, the outermost is the outer layer is the gray matter. Now this is the gray matter. So outer is the gray matter and inner is the white matter. So in case of cerebrum, outer gray and inner is the white matter. Okay, so this is the gray matter here. This is gray matter and this is the white matter. So outer gray and inner white matter. So, but in case of spinal cord, see, outer is the white matter and inner is the gray matter. So this is different. Okay, the organization of the gray and the white matter is different in cerebrum and spinal cord. So this is the cross section of the spinal cord. So in case of spinal cord, the outer is the white matter and inner is the gray matter. That's how it is organized. Okay. So in the brief introduction, you should know the nervous system, it mainly consists of the central and the peripheral. And as we'll be learning central nervous system in this semester. So we'll study the brain and the spinal cord in detail. Okay. So central nervous system consists of brain and spinal cord. So that you must know, and how you are going to study the different parts of the central nervous system here. So it is divided into the cerebrum, then diencephalon, brainstem, cerebellum, and the spinal cord. And the terminology you should know: rostral, caudal, dorsal, and the ventral. Then the organization of the white matter and the gray matter. So in case of cerebrum, the outer is the gray matter and inner is the white matter. But in case of spinal cord, the outer is the white matter. So this is the white matter, the outer. This is white, and this H-shaped structure is the gray matter. Now coming to the spinal cord. Okay. So this is the cerebral hemisphere. Now this is the spinal cord here. Okay. So this is the spinal cord. Now, the spinal cord is an elongated and cylindrical part of the central nervous system. So here you can see, so it is elongated and it is a cylindrical part of the central nervous system. So this is the spinal cord in this figure. Okay. Now it occupies the upper 2/3 of the vertebral column. So within the vertebral column, it occupies the upper 2/3, and it is flattened ventrodorsally, that is anteroposteriorly. So it is flattened ventrodorsally. And here you can see on either side, you can see the 31 pairs of spinal nerves. So the spinal cord, it provides origin to 31 pairs of spinal nerves. So these are the spinal nerves. On either side you can see. So there are 31 pairs of spinal nerves, and they provide the motor as well as the sensory supply to the whole body except the head. So elongated cylindrical part of central nervous system, and it is present within the vertebral column, but it occupies only the upper 2/3 of the vertebral column. Here you can see it is flattened ventrodorsally, and you can see the 31 pairs of spinal nerve, they emerge from the spinal cord. Now coming to the extent, which is important, it's commonly asked in gross if you get the spotter of a spinal cord. So what is the extent of the spinal cord? So it is the continuation of the medulla oblongata. So here you have medulla. So the spinal cord is the continuation of the medulla oblongata, and at the end you can see it ends as a conical structure here. Okay, so it has a tapering extremity, a conical shaped structure, and this is known as conus medullaris. Okay, so at the end of the spinal cord you find a conical shaped structure which is known as conus medullaris. So this is the extent. So it is the continuation of the medulla oblongata, and it ends as a conus medullaris, which is a conical shaped structure. Okay, now come to the vertebral extent. So here you can see C1. Okay, so it starts from the posterior arch of atlas. Atlas is the first cervical vertebra. So it starts from the C1. Okay, so first cervical vertebra, and it extends or it ends at the level of L1, that is the lower border of first lumbar vertebra in case of adult. Okay, so this is different in adult and in newborn. So this is important as well. So the spinal cord ends at the level of lower border of L1 in case of adult. Okay, but in case of newborn, it ends at the lower border of L3. Okay, this you must keep in mind. It has got clinical importance while doing the lumbar puncture. So you should know where does it end. Okay, so you can say lower border of L1 or the disc between L2 and L3. And in case of newborn, it ends at the lower border of L3. Because within the intrauterine life till 3rd month, the spinal cord is equal to the length of the vertebral canal. After that, the vertebral column, it grows rapidly. Okay, so that's why there is difference. Now come to the measurements, which is important again. So the total length of the spinal cord is 45 centimeter, but it is slightly less in case of female. But whenever you are asked the length of the spinal cord, you should always say 45 centimeter. Okay, but it is less in case of female. So the total length is 45 centimeter in case of male, and in female it is 42 centimeter, and it weighs around 30 grams. Okay, I hope you know now. You should know the extent. Then the conical part you should know, this is known as the conus medullaris. Then the vertebral extent from C1 up to the lower border of L1 in case of adult, and in case of newborn up to lower border of L3. Okay. Now here you can see within the spinal cord you can see the two fusiform enlargements. See this one and this one. Okay. So you find these enlargements, one at the level of the cervical region, so which is known as cervical enlargement, and another enlargement is at the level of lumbar region or the lumbosacral enlargement. Okay. So why at these places there is enlargement? Because at the cervical region, as it has to supply the muscles of the upper limb, and there is formation of the brachial plexus, so brachial plexus, and it also forms the cervical plexus. So for that region, it is enlarged here. And similarly, in the lumbar or the lumbosacral region, it forms the lumbosacral plexus to supply the muscles of the lower limb. So it is enlarged at this point. Okay, so spinal cord is enlarged at two levels. So one is at the cervical region and one is at the lumbar region. Now coming to the coverings of the spinal cord. So the brain, the cerebral hemisphere as well as the spinal cord, they are covered by meninges. Okay, the covering which covers the cerebral hemisphere, so they are known as the cranial meninges, and the coverings which cover the spinal cord, so they are known as the spinal meninges. And there is slight difference, okay, between the covering of the cranium and the covering of the spinal cord. So today I'll be telling only the covering of the spinal cord. Okay. Now from outside to inside. Okay, so here you can see this is the vertebra. So this is the vertebral foramen, you can say, or the vertebral canal. So here this is the spinal cord here. So on either side we are seeing the spinal nerves here. So these are the spinal nerves. Then come to the covering. So this is the spinal cord here, and this blue color part. So this blue color structure is the covering. Now the outermost is the dura mater. Okay. The next is the arachnoid mater, and the innermost is the pia mater. Okay. Now the dura mater is the outermost, and it is the strongest. Okay, it is also the toughest and the strongest. So the outermost is the dura mater. And these meninges, they they protect the spinal cord. Okay, so hence it is known as the mater. So mater means mother. So this is the tough mother. The outermost is the dura mater, which is tough mother, and it is strongest also. Okay, as it protects, it is known as or it is surnamed as mater or mother. Now, next layer is the arachnoid mater. Now, this is the arachnoid. So, outermost is the dura. So, next is the arachnoid mater. So, this is arachnoid mater. Okay. And it resembles the legs of the spider. So, it is spidery looking. This is arachnoid mater. And the innermost is the pia mater. So, pia is very delicate. Okay. So, it's also known as delicate mother. So, the innermost. And it is tightly adherent to the surface of the spinal cord, like how the pleura covers the lungs is like that. It is tightly adherent to the spinal cord. So this is the pia mater. So dura, arachnoid, and the pia mater. So this is the spinal cord here. So vertebra here. So these are the three coverings. Now this figure also you can see. So this is the dura mater, and it is also the continuation of the meningeal layer of the cranial dura. The cranial dura consists of two layers, meningeal and the endostal, and this is the continuation of the meningeal layer of the cranial dura as well. And below it extends up to the second sacral vertebra. Okay, it extends up to second sacral vertebra. So this is the dura, the outermost. Now coming to the spaces. Now next is the space. Okay, and this figure also you can see. So this is the cross section. So this is the bony part, the vertebra. Okay, this is the spinal cord here. Now the covering which intimately covers is the pia mater. So this is the pia mater here. Okay, now this is the arachnoid mater, yellow color. So this is the arachnoid mater. So between the pia and the arachnoid mater, there is a space here. Okay. Now this is arachnoid, and the outermost, this again the yellow color line. So this is the dura mater. Okay. And in between the arachnoid and dura mater also there is a space. Okay. Now this is the dura mater, and this is the bone, the vertebral canal. Now between the dura and the vertebra there is again a space. Okay. So there are three spaces. So first is outside the dura mater. So let's talk about the space which lies outside the dura mater. So this space is known as the extradural space. As it lies outside the dura mater, this is known as the extradural space and also known as epidural space. So it is nothing but the space between the dura mater and the periosteum of the vertebral canal. So this is the vertebra. So between the periosteum of the vertebra and the dura mater, so this space is the extradural space. Okay, and it mainly contains the loose areolar tissue. And here you can see the blue color structures. So these are the internal vertebral venous plexus. Okay, so these are the internal vertebral venous plexus, which is one of the important content of the extradural space, and it also contains the root of the spinal nerves. So this is the spinal nerve. So it also contains the root of the spinal nerves. Now coming to the importance of this space, okay, I think I have explained this in the class of prostate also. Okay, what happens during increased intra-abdominal pressure, the prostatic veins, okay, the veins which drain the prostate, the prostatic veins, they drain into the veins of these spaces, isn't it? So during increased intra-abdominal pressure, the prostatic veins, they drain into the veins of these spaces. Okay, so what happens during prostatic carcinoma, the metastasis can also affect these vertebral bodies. You must remember that is the Batson's venous plexus, isn't it? So the prostatic vein has communication with the veins of the extradural space. So these are the veins. Okay, so prostatic carcinoma can affect these vertebral bodies. And this space also extends up to the sacral hiatus. And another important clinical feature of this space is, here you can see, so this is the sacrum here. So these are the sacral foramina. Okay, these are the sacral foramina here. This is sacrum. So here you can see one opening. Okay, so which is known as the sacral hiatus. Okay, so this is known as the sacral hiatus. So from here, there is emergence of the nerve fiber also from here. Okay. Now this space is also commonly used for the anesthesia, so which is known as the epidural anesthesia. You must have heard the terminology, the epidural anesthesia. As it is also known as the epidural space, the epidural anesthesia is usually given from this sacral hiatus for the painless labor, especially for painless labor, and also in certain conditions to relieve pain. Okay, so this is known as the epidural anesthesia. Okay, so that you must remember, the extradural or the epidural space. Now next is the subdural space. Again, as the name suggests, sub means below the dura mater. So here you can see, so this is the extradural space. Now this is dura mater here. Now a very small, here you have a potential space. So between the dura and the arachnoid mater, so there is a space which is known as the subdural space, and it contains the lymph-like fluid. Very small space here, so that is the subdural space. Okay. Now coming to the next layer, that is the arachnoid mater. Okay, so the arachnoid mater is the next layer. So if you reflect, so this is the spinal cord here, so you reflect the dura mater. Now this is the arachnoid mater here. Okay, so this is the arachnoid mater. So it's transparent. Okay, this layer is transparent and it is avascular and it loosely invests the spinal cord. So this is dura. So inside the dura is the arachnoid mater. And this also extends up to the lower border of S2, that is second sacral vertebra. Okay. Now coming to another important space. So this is dura, this is arachnoid. Now below the arachnoid mater, or you can say between the arachnoid and the pia mater, there is a space. So this is known as the subarachnoid space, and as you all know, it contains cerebrospinal fluid. So this is the subarachnoid space, and this space is uniform up to the level of conus medullaris. Then it expands. Okay, the space increases, and when this space increases, it is known as cisterns. Okay, so don't get confused. Cisterns are the enlarged the subarachnoid space. Okay, which contains CSF. And it also contains cauda equina. And the importance of this space is the CSF, cerebrospinal fluid, is usually aspirated from this subarachnoid space, and the site is between L3 and L4. So this is the important clinical feature of this space. I hope it's clear now. So all these spaces are very important. Okay. So the extradural, subdural, and this is the subarachnoid. So this is the subarachnoid space. Okay, this is subarachnoid. There are veins, so that is the extradural. Subdural. So this is the subarachnoid space which contains CSF. Now the next layer is the pia mater, the innermost. Okay, so the innermost covering which intimately covers the spinal cord is the pia mater. Okay, so this is the pia mater. It is vascular. It is vascular and it closely invests the spinal cord. And the important part of the pia mater is it also presents some modifications. Okay, it gives rise to three modifications. So there are modifications of the pia mater, the innermost layer. The first one is the phylum terminal. So what is phylum terminal now? So here you can see the spinal cord ends here at the conus, isn't it? So it ends here at the conus. Now you are seeing here there is a small filament-like structure which extends beyond the conus. So this is nothing but the extension of the pia mater, which is known as phylum terminal. Okay, all these are spot questions, so you should be very familiar. So spinal cord ends here at the level of conus medullaris. Okay, now beyond the conus also you find one filament-like structure. Okay, so that's why it is known as phylum terminal. What it is? It is nothing but the extension of the pia. Okay, so it is also a modification of the pia mater. Okay, which extends beyond the conus. So you can make out easily because conus is a conical structure. So you find one structure which extends beyond conus, that is the phylum terminal, and it leads to that sacral hiatus that I showed on foramen in the sacrum. So that is known as the sacral hiatus. Okay. And it is around 20 centimeter long. Now, another modification is the thickened band of pia mater, which you find in the anterior median fissure. Now, this is the spinal cord. So I'll be telling you the external feature very shortly. Now, this is the spinal cord here. Okay. Now, in the anterior surface of the spinal cord, in the midline, you find a faint fissure here. So, which is known as the anterior median fissure in the midline of the external surface of the spinal cord here. Okay. Now here in this anterior median fissure there is a thickened band of pia mater, so which is known as the linea splendens. Okay. So this is known as the linea splendens. So what is linea splendens? It is also a modification of the pia mater which you find in the anterior external surface of the spinal cord, that is in the midline. Okay. Now coming to the another modification. So see, on either side you are seeing, on either side of the spinal cord here. So when you reflect the dura here, see on either side you can see a triangular or the tooth-like extensions here. See here, this one, the not these are the nerve roots. So between the nerve roots you can see a triangular tooth-like processes. Okay, so there are around 21 on each side. So this is also a modification of pia mater which is known as ligamentum denticulatum. Okay, so these are the ligamentum denticulatum. So this is the lateral extension of pia mater. They are usually found between the nerve roots, dorsal and the ventral nerve roots. So these are the ventral nerve roots. Similarly, at the back you have dorsal nerve roots. So between them you find a triangular teeth-like processes, 21 in number. So they are the ligamentum denticulatum. So these are the extensions of the pia matter. I hope it's clear now. Okay, so you should know the extent, the vertebral extent. Okay, and its level of its termination in case of adult and in case of newborn. Then come to the coverings, the spinal meninges. They are known as spinal meninges as they protect the spinal cord. They are known as, they are surnamed as mother. So mater means mother. So they are dura mater, then the arachnoid mater and the pia mater, and the space is between this covering. So you should know about the extradural space, the subdural, and the subarachnoid space. Okay, and the clinical importance of all these spaces. So that is important. And in the pia mater, you have three modifications. So they are known as the phylum terminal, the one which extends beyond the conus. The other one is the linea splendens, that is the thickened pia mater, which you find it in the anterior surface in the midline. And the another modification is the ligamentum denticulatum. They are the teeth-like processes between the ventral as well as the dorsal nerve roots. Okay, so there are three: ligamentum denticulatum, linea splendens, phylum terminal. Okay. Now coming to the external features of the spinal cord. So what are the structures you see when you see it from outer surface? Okay, so they are the external features of the spinal cord. So I think this we have read in the first year also. I hope you had drawn this in histology, isn't it? So this is the cross section here. So what do you see when you visualize it from the external surface? So here you can see, so this H-shaped structure, the butterfly H-shaped structure is the gray matter, isn't it? Now the outer is the white matter. So this is white matter, this is gray matter. Now this is the anterior part. So this is ventral. Okay, so this is the ventral part or the anterior part. This is the posterior part. Now in the anterior part, you can see a fissure in the midline, and that fissure is deep. Okay, so deep longitudinal fissure in the anterior surface is known as the anterior median fissure. Okay, so what are the structures you see? First is the anterior median fissure, which is a deep fissure which is present in the anterior surface, and it mainly contains the artery that is known as the anterior spinal artery. So there is a anterior median fissure anteriorly. Similarly, the posterior part, there is a posterior median sulcus. So posterior, you have the posterior median sulcus, and it is not, as compared to anterior, it is not very prominent. So you can see only a faint groove in the posterior surface. Okay, so that is known as the posterior median sulcus. Okay, so what are the external features? So you have to look for the anterior median. It's not very prominent as it is shown here. Okay, so when you come to the dissectional and see the specimen, so you will not find this deep. Okay, so compared to the posterior sulcus, it is deep, but it is not this deep. Okay, so what you have to keep in mind is, so anteriorly there is a fissure, and similarly in the posterior part also there is a fissure in the midline. Now, so anterior median fissure is this one. So posteriorly is the posterior median sulcus. Now, on either side, okay, so on either side there are two. The anterolateral sulcus. See, anteriorly this is the anterolateral sulcus, and similarly on posterior part there is a posterolateral sulcus. Okay, so this is the anterior median fissure. Now this is the anterolateral sulcus. Now how do you identify the anterolateral sulcus? Because you can see the emergence of the nerve roots here. So these are the ventral nerve roots, because the anterior part of the spinal cord is motor in function. So these are the ventral or the motor nerve roots. So this is the anterolateral sulcus on either side. Okay. Similarly, you have the posterolateral sulcus on the posterior part, from where you can see the emergence of the sensory or the dorsal nerve roots. Okay, so these are the structures you see when you see the spinal cord from external surface. So anterior median fissure here, then posterior median sulcus posteriorly. Then next to this, you find the emergence of the ventral nerve roots. So that is the anterolateral sulcus. Similarly, posteriorly there is posterolateral sulcus. And this figure also is same. So anterolateral sulcus here, then posterolateral sulcus on the posterior part. Now, each half of the spinal cord is divided into three areas now externally. Okay, so each half of the spinal cord is divided into three areas. Now, first is the anterior area. Now, this is the anterior area. Okay, the anterior area which lies between the anterior median fissure and the anterolateral sulcus. Now, this is the anterior area. Now, next is the lateral area. So, this is the lateral area which lies between the anterolateral sulcus and the posterolateral sulcus. This is the lateral area. Similarly, now posterior area which lies between the posterolateral sulcus and the posterior median fissure. Okay, so anterior area, lateral area, and posterior area. This is these three areas are present on each half of the spinal cord. Now coming to the structure, important again. As I said earlier, there are 31 pairs of spinal nerves which we are seeing here. So there are 31 pairs of spinal nerves which emerge from the spinal cord. Okay. So out of 31, there are 8 pairs of cervical, then 12 pairs of thoracic, 5 pairs of lumbar, 5 pairs of sacral, and 1 pair of coccygeal. Okay. As there are 7 cervical vertebrae, but there are 8 pair of cervical nerves. Okay, so don't get confused. It's commonly asked in Viva, right? Cervical vertebrae, there are 7, but there are 8 pairs of the cervical nerves. Okay, so altogether there are 31. So 8 cervical, 12 pairs of thoracic, 5 pairs of lumbar, 5 pairs of sacral, and 1 pair of coccygeal. Now here you can see, this is the first cervical vertebra here. C1, C2, C3, C4, C5, C6, C7. So these are the 7 cervical vertebrae, but there are 8 cervical nerves. Okay. Now, out of these 8, the 7 pair of cervical nerves, they are arising here. You can see they are arising from the superior part of the vertebral notch, isn't it? So this is the vertebra. So this first cervical also emerging from the upper part, superior part. So this second pair of the cervical nerve is also arising from the superior part of the C2, isn't it? This is C2, so this is superior part of C2. Okay, but only the last one, the 8th cervical, it emerges from the lower part of the C1 or inferior part of the C1, or you can say the upper or the superior part of the T1 vertebra. So this is commonly asked question. Okay. So there are 7 cervical vertebrae, but there are 8 pairs of cervical nerves. Okay, so out of 8, the 7 pairs emerges from the superior part of the vertebral notch, whereas the 8th, the last one, emerges from the inferior part, or you can say the upper part of the T1. So this is the first thoracic vertebra. Okay, this you must keep in mind. Rest, the 12 pairs of thoracic vertebra, they all emerges from the lower and inferior vertebral notch of the corresponding vertebra. So you can see this is T2. So the second thoracic is emerging from the inferior part of the vertebra like this. And even the 5 pairs of lumbar emerges from the inferior notch. And 5 pairs of sacral also. All these emerges from the inferior part. Okay, cervical is the superior part but also. And there is 1 pair of coccygeal spinal nerve, we'll say the coccygeal spinal nerve, which emerges from the sacral hiatus. You say sacral foramina, so this one, the one which is in the midline is the sacral hiatus. So here you are seeing a syringe, its picture is shown, giving the epidural anesthesia. Okay. Now each spinal nerve it has got 2 roots, right? Ventral root and dorsal root. Okay. The one which are emerging from the anterolateral sulcus, the anterior bio, anterolateral sulcus sound is the ventral nerve root bio, and the one which is emerging from the posterior-lateral sulcus is the dorsal nerve root. So ventral it is motor in function, and dorsal nerve root they are sensory in function. And in the dorsal nerve root message, so these 2 nerve roots, ventral or dorsal, they unite and they form the spinal nerve, right? Before the union, here you can see from the dorsal nerve root, you can see one bulge, so this is known as the spinal ganglion or the dorsal root ganglion. Okay? So these are the ventral nerve roots, these are the dorsal nerve roots, they unite with each other and they form the spinal nerve. But what happens here, the dorsal nerve roots, before it unites with the ventral nerve roots, it presents a swelling which is known as the dorsal root ganglion or the spinal ganglion. Now come to another important part, that is cauda equina. Now what is cauda equina? See, this is how the spinal cord looks. Right? Here's spinal cord bio. So this conus, conical shaped structure, this is conus medullaris, right? And your shiny part which you are seeing, so this is the phylum terminal. Okay? Conus here, this is how it looks, right? This is conus and this is the phylum terminal, right? Which extends beyond the conus nearby. See, on either side, you are seeing a yellow color difference. On either side, you are seeing a bunch of nerve rootlets, right? Bunch of nerves difference. This one, on either side, your phylum terminal on either side. So this is known as cauda equina, okay? So the bunch of nerve rootlets, so this is known as the cauda equina, right? Which are suspended from the conus. The conus ko either side na. So this is the cauda equina. Now why it is known as cauda? It resembles the tail of a horse. Right? It resembles the tail of a horse. That's why it is known as cauda equina. And how it is formed? This is part. Usually we'll tie this part. Right? It's not when thread tie. We can tie in phylum terminal, and we can put pin over conus medullaris. So all these are spotter question, right? And cauda equina will tie over this bunch, right? And next question say how it is formed, right? The cauda equina is mainly formed by, so this you have to write, the lower pair of 4 lumbar nerves, then all sacral nerves, and 1 pair of coccygeal nerve. The lower 4 pair of lumbar, all sacral, all 5 pair of sacral nerves and 1 pair of coccygeal nerves. So all these nerves, so they unite and they form a cauda equina. Right? Why it is called cauda? Because it resembles the tail of a horse, and it also contains this phylum terminal. Okay, so this is the cauda equina. So this is also important. Now coming to spinal segment. What is spinal segment? It is a portion of the spinal cord, right? a portion of the spinal cord which gives attachment to one or a pair of spinal nerves. So that portion is known as the spinal segment. There are total 31 pair of spinal nerves. So a portion of the spinal nerve which gives attachment to a pair of spinal nerves is the spinal segment. So total there are 31 spinal segments, and the area of the skin which is supplied by one spinal segment. So that area is the dermatome. There is a dermatome. Now come to the internal features of right? Or you could say external. I just finished external features. Or come to the internal features. Of internal features, to study internal features, you have to take a section, right? So this is the section. So if you take a cross section of the spinal cord, this is how it looks, isn't it? So again, outer white, inner gray, right? But what are the structures you see in the internal features matching? So this is gray, H-shaped or butterfly shaped is the gray matter. This is the white matter. Now, within the gray matter, when you concentrate on gray, right? Gray matter में क्या होता है? जैसे white is gray because it contains the cell bodies, है ना? इसमें the cell bodies are, so that's why it is gray. Within the gray में क्या होता है? So this one, this is the anterior part, because you remember this part, your anterior median fissure. So this is the anterior horn. Okay, this is the anterior horn, also known as the column. So don't get confused, anterior horn or anterior column, right? But this is the anterior horn. Okay. Now, if you go posteriorly over, so this is the posterior horn. So anterior horn you are seeing the short, broad side. Now this is the posterior horn. The long, slender. And this is the posterior horn. Okay. Now in between is the intermediate region. Your anterior horn boy, this is the posterior horn. So between these two horns there is a intermediate region. Now this is the intermediate region, and there is a gray commissure. These two halves, your left half, the right half of the gray matter is joined in the middle by gray commissure, where there is presence of the central canal. Using your canal, so this is the central canal. So the part of the gray matter which contains the central canal, or you can say the part which joins the left and the right half of the gray matter. So this is known as the gray commissure. Okay. So what are the different parts in the internal feature of the gray matter? So you have an anterior horn. This is anterior horn, and this is the posterior horn. Between these two is the intermediate region, and the part which contains the central canal. So this is the gray commissure, right? Now the anterior horn, it is broad and short. So whenever you draw the diagram of spinal cord in histology, I remember I used to make mistakes. That's the anterior horn, so you should always draw shorter than the posterior horn. You broad also, and it is short. Okay. So the anterior horn is broad and short. See, this is the posterior horn. A posterior horn, it is slender. Okay, it is slender, and it is narrow. This is posterior horn. This is anterior horn. Your intermediate area, boy, right? And from the, especially in the thoracic region, from T1 to L to the T1, so your area, it is also known as the lateral horn. Okay, so this area is known as the lateral horn here. Your lateral horn, it is especially in the thoracic region. You find it in the thoracic region. There is the amount of the gray and white matter, so depending upon the areas, say lumbar region, thoracic or cervical. So depending upon that, this amount of the gray and white matter, it varies, right? So especially in thoracic region, the amount of this gray matter, it is less. Okay? So this part, both the part becomes very slender. So this lateral horn becomes prominent. So whenever you see the lateral horn, in cross section, that is usually of the thoracic region. Okay? And this is the gray commissure, where you have the central canal. Now come to white matter. The surrounding part, the periphery part is the white matter, right? And this white is due to myelination of the nerve fibers. White matter, it mainly consists of the funiculi. So familiar, it mainly consists of the funiculi, right? So there are the anterior funiculus. So your anterior region, boy. So this is the anterior funiculus. Only white, you concentrate on white matter. So the anterior funiculus is the part between the anterior median fissure and the anterior lateral sulcus. Now this area is the anterior funiculus, and this is the lateral funiculus between the anterior lateral sulcus and the posterior lateral sulcus. You see, this is the lateral funiculus. Now this is the posterior funiculus between the posterior median fissure, posterior lateral sulcus. You see funiculus. You see this. We are talking only about the internal features. अब यही एरिया अघि के थियो the external surface भन्दाखेरि चाहिँ this was the area, isn't it? यो anterior area थियो, this was lateral area and this was posterior area. So if we are talking about the internal features, यो cross section को कुरा गर्दाखेरि चाहिँ it is present only in the white matter. यो this is anterior funiculus, lateral funiculus and posterior funiculus. Same thing, right? अब अर्को important part चाहिँ the gray matter, only the gray matter, right? It consists, it is gray in color, right? Because of this cell bodies, neurons. So here so you have columnar arrangement of neuron also, right? Columnar arrangement of neuron is यसमा चाहिँ, so this I'll be telling about. अब this is the anterior horn now, होइन? यो चाहिँ intermediate, this is the intermediate area and this is the posterior horn. Okay, now within the anterior horn, so these are the different neurons you are seeing here. Okay, so within the anterior, concentrate only on the anterior horn. You anterior horn मा मात्रै concentrate गर्दाखेरि on the, there is a medial part here, this is the lateral part here, and this is the intermediate part here. Now coming to the medial part, right? There are two you are seeing. So this is the ventromedial nucleus, this is the dorsomedial nucleus. And it mainly supplies the skeletal muscles of the trunk and it. Usually, let's say all of you should practice, right? You should practice this. Your gray matter of the spinal cord. Now, what are the neurons present? You should draw this diagram. So, in the anterior horn, there is ventromedial, there is dorsomedial. And it mainly supplies the muscles of the trunk and neck. I'll come to the lateral. So, this is the lateral part. So, here you are seeing three, isn't it? The black color neurons. So, first is the ventrolateral. So, most anteriorly boy. So, this is the ventrolateral. Next is the dorsolateral. Your ventrolateral. This is dorsolateral. And this is retrodorsolateral, right? Ventrolateral, it is for the upper arm and thigh. Dorsolateral you borrow for forearm and leg, you say. And this is the retrodorsolateral. And you part, it mainly supplies the intrinsic muscles of the hand or the foot. So this is medial, this is lateral. Now coming to the intermediate part. Of intermediate, there are two. You blue colored so there are two. So first one, right, you say this is the accessory nucleus. Accessory nucleus, it mainly supplies the sternocleidomastoid muscle. Right? So sternocleidomastoid, this muscle I think you have not read and you'll be reading in head and neck. Right? It's the muscles of the neck, sternocleidomastoid. I think trapezius, you know, right? These are supplied by the 11th accessory part of the cranial nerve supplied also. So this is the, so within the anterior horn case, there are medial, there are intermediate group and there are lateral group of the nucleus. Now come to the posterior horn. So this is the posterior horn, isn't it? Up to here, right? Your black color, posterior horn. Now posterior horn, this is considered as apex for you. You say base. Now just at the tip, right? Here you find one nucleus that is known as substantia gelatinosa of Rolando, right? You say Kyoto. Substantia gelatinosa of Rolando. And अर्को के भयो यो चाहिँ सबै मोटार भयो, isn't it? I पनि भनेको थिए the anterior horn ले चाहिँ यसमा सबै के हुन्छ त, it supplies the, it is motor in function हैन, यो part चाहिँ sensory in function भयो. So यसले के गर्छ, it mainly conveys the sensations like pain, temperature and touch. Right? The pain, temperature and touch, that is from the substantia gelatinosa of Rolando. And just below it is the nucleus proprius. इसको नाम चाहिँ nucleus proprius. यो सबै थाहा हुनुपर्छ है तिमीलाई. This is the nucleus proprius, right? It lies deep to substantia gelatinosa, and it also conveys the sensations like pressure, touch, pain, and temperature. Okay, and at the base there is the dorsal nucleus. Right? You say this is the dorsal nucleus at the base of the posterior horn, right? And it mainly receives the proprioceptive as well as exteroceptive sensations. Proprioceptive भनेको चाहिँ it mainly conveys the joint or muscle sensation हो हैन. Exteroceptive भनेको चाहिँ touch र pressure, right? So this is the dorsal nucleus, or you can say nucleus dorsalis, right? So posterior horn मा substantia gelatinosa Rolando. Deep to this is nucleus proprius, and near the base say nucleus dorsalis. यो चाहिँ both side मा हो है, यता पनि same. Now come to the intermediate region. This is also known as lateral horn if it is present in the thoracic region and up to the level of second lombard vertebra. This is known as lateral horn. And there are two. You are seeing the medial one. This is the intermedial medial boil. You say lateral boil. Okay, so in the intermediate region, there are two, medial and the lateral. It mainly conveys visceral efferent sensations. Efferent sensation from the viscera. Visceral efferent sensations. So these are the different nuclei. They are present in the gray matter. And there is another arrangement of these neurons. They are usually given gray matter and they are usually represented in the Roman letters. This is also in the gray matter. Right? This is also in the gray matter and they are usually represented by the Roman letters. Right? So this is known as the Rext classification. Right? Rext classification or Rext lamine. Right? Rext classification of the neurons. That is also in the gray matter. So here you can see this is the posterior horn. Your anterior median fissure, the posterior median sulcus भयो. And white matter here you have the anterior lateral हुन्छ, here you have posterior lateral हुन्छ. And gray matter को कुरा गर्दाखेरि चाहिँ there are two horns, posterior, anterior. Posterior sensory in function, anterior case it is motor in function. And thoracic मा चाहिँ up to and thoracic and up to L2 चाहिँ here you have lateral horn. अब Rex classification it is usually represented by Roman letters. So let's focus on posterior horn here. So this is the posterior horn. Within the posterior horn, you find the lamina from 1 to 6. See, this is 1, this is 2, 3, 4, 5, 6. So from 1 to 6, you find it in the posterior region. Can you see the slide? Slide देखिरहेछ?
Yes, ma'am.
देखिरहेछ?
छ, ma'am.
Okay. देखेन भने भन्नु. So from 1 to 6, 1, 2, 3, 4, 5, 6. So all these lamina, they are present in the posterior horn. Okay. Now lamina 7. Okay, this is the lamina 7. And your lamina 7 cancer, it is present in the intermediate region. I use the intermediate region, lamina 7. So this is in the intermediate region, your 7 ball. Lamina 8, right? This is 8. Again, this is lamina. This is 6. Your 7 is intermediate. Coming to the lamina 8, you're saying this is present in the anterior horn. Posterior horn from 1 to 6. All 1 to 6 say they are present in the posterior horn. Right? 7 in the intermediate region, and lamina 8 it is present in the medial part. So this is the medial part of the anterior horn. It's a 8 boy, and 9 is present in the lateral part of the anterior horn. Right? It's a lateral part of the anterior horn boy. And coming to the 10, lamina, it is from 1 to 10, right? Lamina 10 it is present in the gray commissure. So this is gray commissure, okay, now, which contains the central canal. So around the central canal, so here is the lamina 10. Okay. So in this figure also you can see within the UC posterior horn bio. So 1, 2, 3, 4, 5, 6. So they are present within the posterior horn. 7 in the intermediate region. Right. Our 8 counts in the medial part of the anterior horn, and 9 is present in the lateral part of the anterior horn. 9 lateral part of the anterior horn, and 10 counts in the gray commissure around the central canal. So this is the Rext classification. So you should know this also, and you should know this different neurons. Important, so how the muscles of the upper limb so you should know the neurons. Your motor in function, your sensory in function. So this you should know. Now coming to the arterial supply of spinal cord. यहाँसम्म केही छ नबुझेको?
Ma'am, त्यो सब एरेक्नोइड स्पेसमा कर्डा इक्विना हुन्छ भनेर भन्नु थियो नि, त्यो स्लाइडमा थियो, कसरी हुन्छ?
सब अरेक्नोइड स्पेस त तलसम्मै हुन्छ नि त, किनभने त्यो तिम्रो जुन चाहिँ म्याटरहरु छ नि, ड्युरा म्याटर, इट एक्सटेन्ड्स अप टु द लेभल अफ S2 के S2 सम्म हुन्छ के सेकेन्ड सैक्रल वर्टिब्रा सम्म एक्सटेन्ड हुन्छ. इट्स नट दैट इट इज ओन्ली अप टु द स्पाइनल कर्ड लाई कभर त गरेको हैन, इट एक्सटेन्ड्स अप टु S2 सेकेन्ड सैक्रल सम्म हुन्छ के. त्यही भएर तिम्रो सेरिब्रो स्पाइनल फ्लुइड त त्यसरी तिम्रो फ्लो भइरा हुन्छ नि त, इट इज प्रेजेन्ट विदिन दैट के. right? So subarachnoid space मा हुन्छ because the matter जुन तिम्रो meninges it extends up to second sacral vertebra के त्यही भएर त्यसमा space हुन्छ.
Understood, ma'am.
Okay.
Ma'am.
Yes.
Ma'am, laminar arrangement of gray matter ले signify चाहिँ के गर्छ?
यसलाई चाहिँ खाली यो रेक्सले यसले यही सप्लाई गर्छ जसरी यो न्युक्लियसको जस्तो यो मोटर यो सेन्सरी भनेर छैन इट्स जस्ट क्लासिफिकेसन मात्रै हो यसको त्यति उच्चै छैन सिग्निफिकेन्स छैन हैन तर इट क्यान बी क्लासिफाइड एज इन रोमन लेटर्स भनेर यो क्लासिफाई गरेको मात्रै हो.
ओके म्याम.
है जसरी यो न्युक्लियसको चाहिँ इट इज अब यसले यो गर्छ भनेर चाहिँ जसरी यसले अप्पर लिम्बलाई सप्लाई गर्छ हैन यसले नेक मसल्सलाई गर्छ यसले डायफ्रामलाई गर्छ भने जसरी यो छ नि तर यही हर्नमा चाहिँ हैन देयर इज अनदर क्लासिफिकेसन भनेर मात्रै हो यो चाहिँ रेक्स क्लासिफिकेसन चाहिँ.
ओके म्याम. म्याम अनि डर्माटोमको बारे फेरि चाहिँ भनिदिनु न.
ए डर्माटोम भने चाहिँ अब जस्तै हामीले द पार्ट डर्मा भनेपछि तिम्रो स्किन भयो हैन the part of the skin भनौं न हैन which is supplied by one spinal segment. अब spinal segment भनेको चाहिँ के हो त the part of the spinal cord which contains a pair of spinal nerve हैन so there are 31 pairs भयो तिम्रो spinal cord मा हैन अब 31 pairs मा चाहिँ the part of the cord हैन the part of the spinal cord which contains a pair त्यो चाहिँ तिम्रो के भयो त one spinal segment भयो हैन अब त्यो spinal segment नै तिम्रो त्यो एरिया नै तिम्रो स्किन मा छ भने that is dermatome के त्यो नर्भले जुन एरियालाई सप्लाई गर्यो नि सो दैट इज द डर्माटोम है यसमा देखाउँछु फेरि.
म्याम अनि ल्याटरल हर्न त्यो थोरासिक नर्भमा मात्रै हुने
यस्तो हुन्छ कि तिम्रो त्यो यसको जुन अरेन्जमेन्ट छ नि जस्तो ग्रे म्याटर यहाँ छ व्हाइट म्याटर यहाँ छ हैन अब आउटर व्हाइट भनेर बुझे हामीले स्पाइनल कर्डमा इनर ग्रे म्याटर छ हैन द अमाउन्ट अफ व्हाइट ग्रे म्याटर चाहिँ के हुन्छ इट भेरिज डिपेन्डिङ अपन द एरिया के बुझ्यो सो डिपेन्डिङ अपन द एरिया चाहिँ इट भेरिज है अब जस्तै सर्भाइकल रिजनमा एज यु गो अप हैन यु फाइन्ड मोर अमाउन्ट अफ व्हाइट म्याटर लेस ग्रे म्याटर त्यस्तो हुन सक्छ कि एन्ड एज यु गो डाउन हैन तिम्रो चाहिँ व्हाइट म्याटर चाहिँ कम हुँदै गयो सर्भाइकल रिजनमा गयो भने तिम्रो के भयो त व्हाइट म्याटर बढी हुँदै गयो सो डिपेन्डिङ अपन द्याट थोरासिक रिजनमा चाहिँ के हुन्छ एन्ड डिपेन्डिङ अपन द्याट पनि कस्तो हुन्छ भन्दाखेरि सर्भाइकल रिजनमा चाहिँ के हुन्छ एज इट हेज टु सप्लाई अल दि अप्पर लिम्ब मसल्स हैन अप्पर लिम्ब मसल्सलाई सप्लाई गर्नु पर्दाखेरि के हुन्छ इफ यु सी द क्रस सेक्सन हैन यो एन्टेरियर हर्न पनि इज मोर ब्रडर है यो जुन एन्टेरियर हर्न छ नि त्यो पनि मोर ब्रडर हुन्छ के वाइ बिकज इट हेज टु सप्लाई मोर मसल्स हैन त्यस्तो हुन सक्छ अब त्यही भएर सर्भाइकल रिजनको एन्टेरियर हर्न अलिकति यो ब्रड हुन्छ एन्ड एज यु गो डाउन हैन सिमिलरली लम्बार रिजनमा पनि तिम्रो एन्टेरियर हर्न चाहिँ यो एन्टेरियर हर्न चाहिँ ब्रड हुन्छ किनभने सर्भाइकल र लम्बार इन्लार्जमेन्टमा स्पेसली चाहिँ एज इट फर्म्स द प्लेक्ससेस हैन त्यसले गर्दाखेरि चाहिँ यो स्पेसली यो मोटर हर्न चाहिँ थिक हुन्छ है तर थोरासिक रिजनमा के हुन्छ तिम्रो बोथ हर्न्स बोथ एन्टेरियर एज वेल एज पोस्टेरियर हर्न स्लेन्डर हुँदाखेरि चाहिँ इट बिकम्स मोर प्रोमिनेन्ट कि ल्याटरल हर्न चाहिँ त्यही भएर चाहिँ त्यो देखिएको कि है it becomes more prominent. त्यही भएर तिमीले if you see many slides of spinal cord को धेरै slide हेरिरहेको छ भने चाहिँ हैन if you see lateral horn so that is especially of the thoracic region. बुझ्यौ?
ओके म्याम. हजुर.
अरु पनि छ है स्लाइड्स मा के now coming to the atrial supply blood supply नै important छ यसको हैन so coming to the atrial supply के हुन्छ भन्दाखेरि चाहिँ there is anterior spinal artery हैन and there are posterior spinal arteries also so you remember the anterior spinal artery and posterior can you see the slide देखिरहेछ slide
yes ma'am
okay यहाँ त के आइरहेछ So anterior spinal artery or posterior spinal artery, right? So they are the branches from the vertebral arteries. So vertebral arteries ko pani you'll read in head and neck also, right? You say vertebral arteries in different parts also. They mainly arise from the fourth part of vertebral arteries, right? So the anterior, the posterior spinal arteries, they are branches from the fourth part of the vertebral arteries. Isko main supply is your body. Anterior spinal artery, remember, posterior spinal arteries. So they are coming from the fourth part of the vertebral artery. So, suppose your boy, right? So this is the spinal cord boy, or this is the vertebral artery boy. Or vertebral artery ko pani first part, second part, third part, fourth part. So from the fourth part के हुन्छ the anterior and the posterior spinal arteries arise like this है यो vertebral artery बाट आयो anterior and the posterior spinal arteries अब के हुन्छ भन्दाखेरि on the anterior side there is anterior spinal arteries. Now these arteries they are reinforced by many other branches. Right? I've seen this figure. Your main artery यताबाट आइरहेछ तर here yes at regular intervals there are so many small arteries. So they are also known as the radicular arteries. Arteries so there are so many arteries. So in the anterior part you will find around 8 radicular arteries. Okay, so they are known as radicular arteries. So it's supplied by antispinal artery. At regular intervals, there are so many small arteries. And these radicular arteries, अर्को चाहिँ therapeutic पनि हुन्छ हैन mainly for the diagnostic चाहिँ you do हैन to rule out meningitis different types of meningitis हरू अब अर्को चाहिँ अरु CNS diseases हरुको लागि चाहिँ you do this procedure lumbar puncture एउटा भयो हैन अब यसमा अर्को important के भनेर भन्दा चाहिँ this is very important the structures pierced during lumbar puncture so what are the structures you are going to pierce from outside is this recently I saw this in surgery ma pani sodeko थियो है so even when you read surgery हैन त्यतिबेला पनि they commonly ask this is important so what are the structures that are usually pierced भने चाहिँ outermost is the skin right so next is the superficial fascia right त्यसपछि next is the supraspinous ligament so these ligaments all these are attached here in the vertebra and when you study vertebra you know that so superficial fascia supraspinous ligament here right supraspinous ligament then comes the interspinous ligament then ligamentum flava also त्यसपछि areolar tissue हैन that is in the intervertebral venous plexus summary next is the dura mater right dura mater and this is the arachnoid mater so this is the subarachnoid space right so the structures space is very important sir and the site is also important अब अर्को चाहिँ what is spinal block you must have heard हैन spinal block मा गर्यो surgery like अब अहिले त cholecystectomy and even the cesarean section are usually do under the spinal block अब what is spinal block भन्दा पनि it's like the lumbar puncture जस्तो भयो हैन the anesthetic agent is usually injected directly into the subarachnoid space बुझ्यो so anesthetic drugs is usually injected into the subarachnoid space so it's spinal spinal anesthesia or the spinal block so this is nowadays commonly done during cholecystectomy ma pani during cesarean section during cesarean section अर्को चाहिँ anesthesia of the lower limb हरुको गर्नु पर्दाखेरि चाहिँ especially in the cesarean section कोली नभनौं especially in the cesarean section मा चाहिँ you give a spinal block right त्यसपछि next is the epidural मैले अघि पनि भनेको थिएँ हैन epidural anesthesia चाहिँ त्यसमा पनि के हुन्छ you inject the anesthetic drugs in the epidural space right and your epidural anesthesia is usually given during the painless labor painless childbirth हरु गराउँदाखेरि चाहिँ epidural anesthesia दिन्छ अनि usually cesarean section मा चाहिँ you give the spinal block अर्को चाहिँ अब spinal cord injuries हैन स्पेशली तिम्रो in the road traffic accidents हरु गर्दाखेरि चाहिँ there is cut section or transection of the spinal cord can occur. Just because there will be loss of sensation, as well as the loss of motor function, below the lesion. So depending upon the site, the lesion, depending upon the site of the lesions, the effect occur, right? And there is one clinical condition which is known as Brown-Sequard syndrome. That's what it usually occurs in the hemisection of the spinal cord. Only half of the spinal cord is cut, right? That results to Brown-Sequard syndrome. And depending upon the lesion, I said, above C4, a patient can die with respiratory failure. C4 supplies the diaphragm. Below T1, the thoracic muscle, follow up with the injury batch, it usually occurs parathesia, the lower limb muscles dancer. And also compression of the this spinal nerve roots can occur, especially in the prolapse of the intervertebral disc. Intervertebral disc you must have heard, isn't it? These are the vertebrae, and between the vertebrae there is intervertebral disc. This mechanism, the prolapse can occur. So prolapse of the intervertebral disc, it can compress the surrounding spinal nerves. Also, what is myelogram? If you take a plain X-ray, a plain X-ray of the region, abdomen, you will not see this structure. Okay. That because even in X-ray of the chest, you cannot see the bronchus. Okay, so to visualize certain areas, so you have to inject special dye. So similarly, if you want to visualize spinal cord here, spinal nerve roots, so you have to inject a dye, the contrast media. So that is known as the myelogram. Right? So injection is given, or the radiopaque dye is injected in the subarachnoid space, and here. After that, you can visualize the spinal cord, the spinal nerve roots. So this is known as the myelogram. Once a CT scan is done, and you can see the vertebra here, the intervertebral disc spaces, or you can see, and especially to see the compression. Here you can see compression of the disc prolapse. So CT can be done, or MRI. So MRI can be done. So all these are the clinical importance of the spinal cord. I hope it's clear now. What is poliomyelitis? It is the viral infection of the gray column or the gray horn of the spinal cord. Right? So acute viral infection of the gray column of the spinal cord. Our anterior gray column, it is motor. Right? So there will be motor nuclei of the kidney nerves will be affected. Right? So that will lead to the death neurons, so paralysis of the muscle can occur. Right? This leads to polio. Right? Poliomyelitis is nothing but the viral infection of the anterior gray column. You should always keep in mind anterior, because anterior is mainly concerned with the motor function. Right? Posterior is in the sensory function also. Right? So this you must remember. So this completes our class, right?